My name is Fiona. I pick up the patients for St. Joseph's Day Hospital in Raheny. We usually pick up our first patient the furthest away. We start out in Balbriggan in the morning times and work our way back into the city. A lot of the patients would be nervous coming in, especially if it's their first time. They sometimes think that we're not going to bring them home, so we reassure them that they'll be brought home, and we make their journey as comfortable as possible, and they get a bit of lunch when they come in here, and we try and get them home as quickly as we can in the evening time.
The day hospital at St. Joseph's Hospital in Raheny opened its doors to North Dublin's elderly community in 2014. The facility is part of Beaumont Hospital campus and caters for older people who have non-acute care needs. Typically, patients will attend the day hospital on referral from their GP or from the main hospital to access follow-up and ongoing rehabilitation. The treatment they receive here helps them remain in or return to their own homes as soon as possible, and to remain in their own homes for as long as possible. This building cost €2.2 million and was 100% funded through private donations. 1.5 million of this was donated by the Raheny family in memory of Tim Raheny, and the other €700,000 was donated by Beaumont Hospital Foundation from general supporter funds. This purpose-built facility has been designed specifically for the needs of older people. It's a medical, social, and educational one-stop shop for older patients where they are looked after in a calm and relaxing environment. The day hospital operates Monday to Friday and is consultant-led each day. Our patients typically arrive between 10 and 10:30 and often remain here for the whole day while they are waiting to attend appointments with the doctors or the other specialists here, including physiotherapists or occupational therapists. We're able to provide them with their lunch and the companionship of others of their own age while they wait.
Our day begins by a member of our nursing team handing over to the multidisciplinary team on our patients who are coming into the day hospital today. We will have reviewed our case notes, and this helps us to be able to plan our patient care by allowing us to know whether it's their first time here or whether they are return patients. This allows us to plan and ensure that they have a smooth visit to the day hospital. On arrival, each patient is taken into the assessment room. They'll have their vital signs done, they'll have a weight check, and then they'll have an interview done with a member of the nursing team before they are taken in for their appointments.
Desmond, we're just going to bring you in here and hand you over to Katrina, and she's going to take your bloods here today.
Hi Desmond, how are you?
Thank you very much.
Will you just take a seat for me, Desmond?
Yeah,
just over here, Desmond.
Right.
Desmond is here with us today because he is one of our regular patients. He attends to have his blood tested every 4 to 6 weeks because he's on a drug called warfarin for atrial fibrillation, and he's had mitral valve replacement as well. He's well supported by the day hospital, and he's linked in with us, and if we can see any deteriorations or any problems arising, we're able to link him in with the multidisciplinary team to keep him independent, keep him active, still driving, still able to see his friends, so supporting him that way.
Sister Teresa is a lady in her early 90s. She had a fall at home in the convent. She was treated in the emergency department, and then following a period of rehabilitation in the rehab unit in St. Joseph's Hospital, she was discharged home to her convent. We are seeing her for her first visit to see how she is getting on, and today we will see her and link her in with the physiotherapist and see how she is progressing.
Today, Sister Teresa has been referred to see myself, the physiotherapist, just to establish how she's been getting on from a functional mobility balance point of view since she was discharged from the rehab unit earlier this year, just to get a sense of whether there are any new issues or concerns or anything that we can influence from a physiotherapy perspective. So it's just to establish her progress since that point. And particularly from my point of view, there's a number of assessments that were completed in the rehab unit before she was discharged, and I was just looking to see how she was getting on from that point of view today, to reassess her essentially, and to figure out whether there's any decline in her function, in her mobility, in her balance or her cognition, whatever it might be, and then to address any issues that we might pick up in that assessment. The idea being to improve her confidence, her mobility levels and her overall quality of life.
So the next patient we're going to see is Mrs. Elizabeth Leslie. She's a 96-year-old lady who we're delighted to see at the day hospital for a follow-up review appointment today. Mrs. Leslie was an inpatient with us approximately a year ago when she was extremely sick. She had a lot of medical complications and it took a long time for her to recover. She was in Beaumont Hospital, and as she improved, then she came over to our rehabilitation ward on the St. Joseph's Hospital campus. Seeing her here today and seeing how active and independent she is, and the fact that she's back at home is a great tribute to her resilience and to her family's care, but also to the medical staff and the multidisciplinary team that looked after her both in Beaumont and in St. Joseph's Hospital.
Therese Sugru is attending the day hospital for the first time. Therese was seen by Professor Kieran Donegan in his outpatient clinic in Beaumont Hospital. He was concerned about her weight loss and functional decline, and she is here in the day hospital for a comprehensive geriatric assessment. At age 83, Therese lives alone in a 2-storey house. She'll be seeing the dietitian and the occupational therapist today to determine what factors, physically or cognitively, are contributing to her weight loss and functional decline. The OT session will focus on Therese's ability to carry out self-care, home-related activities and social or leisure activities. The aim of the session is to improve Therese's functional performance, maximise her independence and to help her link in with community services. Therese performed quite well in the kitchen. I suppose we identified some basic difficulties that she's having in the home environment as regards height and access to items in the kitchen. So we had, I suppose, a discussion around the actual kitchen environment and a way that maybe she can set up her home environment to suit her current needs. So things like keeping items at hip height, so she doesn't have to do any high reaches or too many low bends, keeping items in the fridge at a level that's more to do with hip height. So today the focus was predominantly around more kind of physical changes that Therese is experiencing at the moment. From a cognitive perspective, she actually performed very, very well.
I came to see Professor Donegan because I had a stroke last August, and I was 5.5 months in hospital, 4.5 in Beaumont and a month in St. Joseph's.
And how are you doing now?
Well, according to the professor, I'm doing very well.
Great. And how are you feeling personally?
Great, thank God. Great.
Yeah.
I had a check-up today, so they were very pleased with it. And I saw, I don't know how many doctors I saw, but they're all pleased. I went to see the physio. So she got me walking on my own, up and down, and she was pleased with me.
Good.
And the people are ever so nice, and especially in the kitchen. They gave us a lovely meal.
Good.
Well, I'm here today for various reasons. Having had stroke and various other illnesses, and it's just a check-up, really.
Do you come regularly for checkups?
Well, whenever they send me a letter every so often.
Okay.
And so I usually come if they send me a letter.
Okay.
It's just one hopes one is well, you know.
Absolutely.
And that's one way of finding out is to come here.
Absolutely. And so you've been told today that everything's fine?
Well, so far I haven't heard anything to the contrary, you know. So that's good news.
The day hospital here in St. Joseph's opened its services in 2014. This has extended our services in that we already have a rehab unit on site and we have a community nursing unit on site. The opening of the day hospital has given us the opportunity to extend our services. Now our patients who are being rehabbed in-house can be discharged home earlier and return to the day hospital for their continuation of their rehab.
After a full day, the patients are ready to go home with the appointments for their next visit. Some have family to take them home and others are returned home by Medialink transport, and Fiona will see the patients safely inside.